So I'm actually a child clinical psychologist, and so prior to joining the department, I worked in clinical practice for a number of years, and so did that in a few different settings, mostly in hospital-based settings, and I think what kind of inspired me to join family social science was I wanted to see sort of a broader level of change in the work that I was doing. And my research focuses on community-based preventive interventions for youth and families who are facing mental health problems and also behavioral substance use challenges. And so a lot of what I do is try to kind of optimize or improve some of the programming that youth and families receive as a part of those services. And so as a graduate student, there's a lot of different ways that they might become involved, and both at kind of the direct service level, oftentimes students are able to get involved with with collecting different research measures from families to help helping to evaluate some of the services that are being provided. So they might sit in on a group session and rate to what extent is the therapist following the protocol for that session. They might meet with families and try to assess different aspects of their mental health or their behavioral functioning. And then I think on the sort of the back end of it, a lot of what my students do is help me with data analysis and writing papers and really trying to kind of better understand what we found through all those through all of our efforts out in the field. And so through my work, what we do is try to kind of better understand what our family's unique needs, and how can we best serve those through through providing prevention programming. Yeah, I mean, I think, and in some ways, this is, I think, the benefit of being involved in direct clinical work is that you get to see some of the more hands-on aspects of how different types of mental health services can really benefit families. And sometimes through research, it's easy to be a bit removed from the actual applications of your work, because you're spending a lot of time not around the families that you're directly serving. And so I think that's one of the things that I really value about maintaining some clinical involvement, is that I'm able to really see changes in families and see how as parents learn new approaches to responding to challenging behaviors in their kids, how they feel empowered, like they're really able to respond in a more effective way, and they see their children responding in a more positive way as they adjust their approach. So I think seeing those really day-to-day changes is something that I think is an important aspect of being involved in this kind of work at all levels. Sure. So one study that I've been involved in was targeting youth who seem to be at risk for kind of early substance use. And so this was a school-based study where we identified a large sample of adolescents who were kind of showing some early substance use behaviors. And we provided a relatively brief intervention program for them that had one of two formats. It was either a kind of a youth-only program where they received two kind of youth-oriented sessions that that worked on building their motivation to change and addressing some of the risky situations that they might find themselves in that would promote substance use. So some of those areas were in those two sessions. And then the other format that they received, that some of the youth received, was a youth and a parent version. And so they received those same two youth sessions, but with the addition of a parent focus session that helped to address parents setting effective limits for their kids, monitoring what their kids are up to. So we compared those two formats with the goal of kind of better understanding who seems to benefit most, or who needs which of those two forms, because oftentimes both community agencies, schools are faced with limited resources, and so So if they can, if they can offer a brief program that's just as effective as, say, a more intensive program, oftentimes the brief program is going to be the way to go. And so our question was, who really needs that additional parenting session? And we were able to identify using a measure of kids' risky decision making. So looking at the extent to which kids tend to make kind of impulsive or careless choices, we were able to come up with sort of a decision rule for who should receive, who seems to benefit the most from this youth and parent version versus the youth only version. And it turns out that kids who scored above a certain level on this measure that we had really benefited a lot from having this additional parent session, whereas kids who were not showing a lot of impulsive or careless choices that they were making seemed to benefit about equally from this youth only and the youth and parent version. And so that was a nice finding, and that I think we can then make pretty clear recommendations to a school who might be considering, okay, who do we offer which program to. Based on using this fairly simple measure, we can predict who's going to benefit the most from each one. I love being a part of the family social science. It's a really interesting department because I think we all come from many different disciplines and many different backgrounds, and but we share a common interest in promoting the well-being of families, and I think that brings such a lot of richness to all of our work, that cross-disciplinary kind of environment.